Improving assessments. We are making changes now to make the process more straightforward for people claiming benefits. We want to find out what works and what we can change in future to make the assessment process better. What we heard from the consultation. We asked you for your thoughts on the work capability assessment and suggested some specific changes. This is the test used to decide whether welfare claimants can get sickness benefits. People replied to say they wanted changes, but did not agree on what specific changes should be made. About half of you supported the specific changes we suggested, and some people raised concerns. There was broad support for data sharing between benefits, but some concerns were raised. What we are doing. As of September 2017, we stopped the reassessment for benefits for people with severe conditions. Over the next few years, we want to bring in even more change. But we want to be sure we are doing so in the best way, so we will test what works first. We will be looking at ways to improve people's experiences of claiming benefits, using data we already have where we can. Helping people who are in the support group. We want everyone in the support group to be able to get the best help possible. What we heard from the consultation. Most people felt that we should provide employment and health support to people in the Employment Support Allowance Support Group and Universal Credit Support Group, but that this support should be voluntary, and that they should get to decide whether or not to take this support. What we are doing. We have already started looking at the needs of people in the support group. We are also doing more work on the idea of personal budgets. Money allocated to people so they can support their needs. Over the next few years, we will be trialling lots of things and working with the public to develop the best support we can. Chapter 2. Supporting employers to create healthy, inclusive workplaces. We want to work with employers of all sizes to help businesses and people use the opportunities available. We know that things are changing. Businesses are noticing the benefits of employing people from different walks of life. We know that some businesses have done really good work to make their workplaces open and welcoming, but we want all employers to do this. Technology and government action has already made it easier for employers to support disabled people and people with health conditions, but we want to do even more. Improving advice and support. We want all employers to be able to access advice and support easily. What we heard in the consultation. Employers felt that support and information was often hard to find. Employers also said that advice and support needed to be different for different needs. Employers also told us that local networks were important and that the government needs to bring businesses together to create local action. What we are doing. We will improve advice and support for employers at a local and national level, and will cover many disabilities and health conditions. This year we will work with employers to start researching and finding solutions. We will also work with voluntary organisations and other government departments to achieve the best change. Over the next few months, we will make big changes to access to work. We will test whether personal budgets can offer better personal support. We will also work to make sure specialist equipment moves with a person when they change jobs. We will also be working with schools and colleges to make sure that young people know about access to work, so that they can get the best out of the support out there. We will enlarge the mental health support service so that it can meet demand. We will also work with disabled people, their families and related organisations to create the best support possible for people with learning disabilities and mental health conditions. We will also continue to grow Disability Confident, a voluntary scheme to get employers to think differently about disability, but more importantly, to act differently. The scheme helps employers to develop their skills and procedures and provides advice and good practice that will help them make the most of the talents of disabled people. We have started work with Cornwall and Isles of Scilly Local Enterprise Partnership to promote employment for disabled people and people with health conditions in a local setting. We know that managers and business owners are important in the work we do. We know that they have a big role in creating a healthy work environment in which disabled people and people with health conditions can grow and become the best they can be. We are working with partners to identify how we can share the support and skills line managers need to have to help employees to be the best they can be. Some employers already support disabled employees and employees with health conditions to be the best they can be through mentoring, training, and networks. We will work to create information on what works best for all employers to use. The civil service as a leading employer. One way we hope to bring change is through the civil service. We want the civil service to lead the way and show other employers how they can be successful. What we heard in the consultation. Employers expected the public sector to lead. Many employers said the civil service could share examples of things that have worked well. What we are doing. All main government departments are now disability confident leaders. This is the highest level in the Disability Confidence Scheme. But we want to go even further. We want to train all civil service leaders in mental health and well-being. Later this year, we will test the training. From January 2018, we will train senior civil servants and key managers to change the culture towards mental health in their departments. After this, we will train leaders at all levels. We will also organise workshops with employers in the private and third sectors to develop the best ways of including disabled people at work. We also want to provide more work experience for people on the autistic spectrum. We will do this alongside an expert partner. The civil service will also focus on increasing the flow of disabled people into the senior civil service. We will also accept the recommendations for the civil service made by the Stevenson Farmer Independent Review into mental health and employers. We also know that there is lots of great work in the public sector that is outside of the civil service. We will bring together public sector leaders in spring 2018 to talk about what works well and what more we can do. Increasing transparency. What we heard in the consultation. When we asked you about what you thought, you said that reporting and transparency can help employers understand their workforce better and encourage employers to create a workplace where disabled people can thrive and reach their potential. What we are doing. We want bigger employers to report on how they are doing on mental health, well-being, and disability in their workplace. We will work together to understand the best way to do this, which works for everyone involved. Statutory sick pay. We want to change the statutory sick pay system so that it allows for more flexible working, such as phased return to work. People told us they liked this idea. We will do more work and bring forward a consultation before we make this change happen. Incentivizing employer action and support for employees. What we heard in the consultation. When we asked you what you think, people had different views about incentives and whether they should be used to get employers to recruit or retain employees. Some people liked the idea of incentives, thinking that they would help employers to do more to support disabled people and people with health conditions. Some people were worried that businesses would employ people for the wrong reasons. What we are doing. While we know we need to help more people become employed, we also need to help people who are in work stay in work. We want employers to manage ill health and chronic conditions in the workplace. We're therefore looking at research and what people have said to us in the consultation. We are thinking about a range of options, including the changes to statutory sick pay that Matthew Taylor proposed in his review, and also what the Stevenson-Farmer review said about financial incentives for small and medium employers. We will also consider how to take forward a national insurance contributions holiday alongside this work. In our work on this, we will want to make sure that any changes have the right impact on employers and how they employ people. We will also look at services that employers can take up to support their workers.